Thanks very much. Good afternoon. I'm Kathy Toon. I'm reconvening the board meeting as we transition into the Hennepin Healthcare System's 2022 annual meeting. Welcome to those of you who joined us in person and to those who are attending virtually. I know that we have a number of elected officials and their representatives, some with us here in the room, some virtually or remotely, and I want to welcome them in particular and thank them. Congressman Phillips and Congresswoman Omar, staff are with us, and we really appreciate their taking the time to be with us. Our legislative leaders as well and their staffs, thank you for being with us. As we get started, I also want to thank Catholic Charities Endeavors for hosting us. Our board has not been together since early in 2020, and it was just fantastic for us all to be together anywhere, but to be together in this beautiful space and have an opportunity to see what our partners are doing here in the community has been a great experience for us. So thank you to Catholic Charities. Before I go farther, a little housekeeping. If you have questions as we go along, please hold those. We'll have a Q&A session here and take those questions in person. If you are with us remotely, please put them into the Q&A on the Zoom feature. And we've got a team who will make sure we don't miss those. We are recording this session. And so if we don't get to all of the questions during this recorded time, we will make sure that we answer those and include those in the material that's posted and would be available later in the About Us section at hennepinhealthcare.org. So again, thank you for being here and thanks for your interest. We want to tape this in addition because we want to be able to share it with some of our board members who are not able to be here and stay, but also with all of our team members at Hennepin and our partners in the community. As we review the past year, we're going to focus today on partnerships that make it possible for Hennepin Healthcare to serve our community. Some of these are partnerships that have been in place. Some of them are new. We're very, very excited about the important role of strategic partnerships as we continue to improve our efforts to serve this community. We'll also be reviewing our community health needs assessment, provide a brief update on our future planning process, how we're engaging the community in that work of thinking about the future and trying to be ready for the future. As I mentioned, this is an extension of a regularly scheduled meeting of the Hennepin Healthcare System Board of Directors. So let me start next by introducing that board. You see them here. These are representatives from community who commit their time as volunteers because we believe that the work of a governing body for this 501c3 of Hennepin Health is so important, ensuring that we maintain alignment with mission. Babette Apland, Jennifer DiCabellas, our CEO, is also on the board. Commissioner Irene Fernando, Commissioner of Hennepin County. Jacob Gale, who's with us here. Commissioner Marion Green from Hennepin County. Brock Nelson, who's here with us. Mohammed Omar, Chris Peterson, Artie Prasad, who is a system physician. Steve Thompson, who's here with us, our vice chair. Diana Vance Bryan, Craig Warren, Thomas Wyatt, also a system physician, and David Ibarra. They put a lot of time, passion into the service on this board, and I know they appreciate your interest in work that we're here to share today. I also want to recognize the full Hennepin County Board of Commissioners, our partners in this work. Hennepin Healthcare System is a subsidiary corporation of Hennepin County, an unusual construct, and the county board approves the corporation's annual budget, has other responsibilities per our bylaws. As you saw, Commissioner Green, Commissioner Fernando currently serve Hennepin Healthcare, System Board. We're honored to have them as partners, but we also want to thank all the commissioners from Hennepin County, Commissioners Lundy, Conley, Gattell, Latondras, and Anderson, for ongoing partnership and support of Hennepin Healthcare. We meet with them regularly and very much appreciate their partnership. And our community is deeply involved with this healthcare system, perhaps today more than any time in our past. We have representatives from community on our boards, our board committees, the Research Institute Board, the Foundation Board, which is where we do our philanthropic fundraising. In addition, we have advisory boards that bring expertise from the community to help guide our system on an ad hoc basis. Thanks to all who share their time and talents by serving on these boards and these committees. Lastly, I want to take just a minute to recognize the executive leadership team at Hennepin, who guide the organization as it seeks to fulfill this critical mission in partnership with community. Jennifer DiCabellis, our CEO, Dr. Hampton, Dr. Hoodie, Derek Hollings, Dr. Cedarstrom, Wendy Stolik-Matzel, Dr. Megan Walsh, Kelly White. Fantastic group of professionals. We're honored to have an opportunity to work and serve with them. Now I'd like to turn it over to our CEO, Jennifer DiCabellis, and her team, who will lead us through the rest of the meeting this afternoon. Again, thanks very much for being here.
Thank you so much, Kathy. And again, I just want to echo the thanks to everybody, both online and in person. We don't take your commitment to Hennepin Healthcare and our mission lightly. I want to add my thanks to the Board of Directors, to the County Board, and to the community members, so many of you who give your time and talents and your commitment to Hennepin Healthcare. And I'll also extend a thank you to our executive leadership team, many of who you're going to hear from today. Hennepin Healthcare is one part of the ecosystem that makes our community incredible. It involves other organizations, other programs, other efforts and initiatives to actually improve the health of our community. We know we can't do this work alone, and today you're going to see us highlight how big of an effort it is and how we're partnering together. Our mission is to ensure that we are the community's healthcare system, the system that responds to what our community needs, responds to what our state needs, and that involves a lot of listening, partnering, and constantly improving. In response to traumas we see, in response to creating recovery and healing environments, and to ensuring optimal wellness for our community. A key focus for Hennepin Healthcare this entire year has been on investing in wellness. And one way that we do that is through a push towards health equity. You're going to see a lot of that today. It is about eliminating structural and interpersonal racism within healthcare. We're making progress, and one of the many things that is making a difference is how connected we are intentionally with our community, how connected we are with our partners and moving the work together, listening, learning, and working together, not always taking the lead, but being a true partner. Our strength as an organization comes from these partnerships. And today, I, along with other members of our executive team and senior leaders, are going to tell you just about a few of those partnerships. And we struggled to make it concise because if you had to listen to them all, we'd be here for a long time. We selected just a handful that we think are impactful to the mission we serve. We'll highlight community partners, and those partners include local community partners, state partners, government partners. And I highlight the state, the local, and the government partners as so essential because public policy is one lever that we can pull to improve community health. And without that, makes our jobs a lot harder. The decisions of elected officials have tremendous impact on a public safety net health system, on our patients, on our employees, and on our system. So we are in frequent communication with the city, with the county, with the state, and with federal elected officials to make sure what's important to our community, what we're hearing from each and every one of you, is shared at all levels of government. We're proud to advocate as a health system for resolving homelessness, for investing in maternal health, substance abuse, mental health, and so much more. We couldn't do that at Hennepin Healthcare without working together to care for our community, and I want to thank all of you as partners. No matter how involved you are, how big or small, it all makes a difference. That's where together we're a stronger community. There's a formal structure that we go through, the Community Health Needs Assessment, that defines how one way that we listen to community and how we build action plans related to that in order to make sure that the focus area for Hennepin Healthcare is the focus that our community wants us to have. And with that, I will ask Amy Harris to come and share a little bit about our annual plan work.
Thank you, Jennifer. I'm Amy Harris, the Population Health Director. And I'm here to tell you a little bit about a process that we go through in a very structured way to be able to listen to community and understand what they think to be the most important health needs that are present. It's a process that every nonprofit hospital does go through. We go through it every 3 years. And an important element of it is for us to first define our community. And so we define that as the cities and the neighborhoods where the majority of our patients live. And as we've stepped into this process for this year, which is on a 3-year cycle, we've made sure that from the very beginning, we've engaged community in this in a rich and important way. So to start out the process, we actually invited community members to be part of our planning team from the beginning. And they've been sitting at the table with leaders from Hennepin Healthcare, as well as some leadership from the Hennepin Healthcare Research Institute, which has also been an important partnership for us in this work, to be able to step into this work to define and ultimately understand what are the most important health needs. So the visual on the screen is showing you the themes that are emerging from this year's needs assessment process. Some of them are themes that we have heard before: access to care, culturally responsive care and services, building trust, community-centered care. But you can also see in this year's assessment, we're seeing some new themes emerging that we hadn't seen before. The impact of COVID, for example. The last time we did the assessment was 2019. And so this is a fresh look this year. And another one that has come up more distinctly is the emphasis on safety. Also one that I think we heard in the past, but not to the degree to which we've heard it now. So going forward, we're going to take all these themes and inputs, which we heard through community-based interviews and small focus groups, and bring them into a large session in the middle of October with community, where they'll digest the information and ultimately help us decide from their lens, what are those most important health issues that we need to tackle going forward. And that kicks off then a series of action planning from which important activities will result. So when we wanted to focus for you, like Jennifer said, on some partnership work, one of the partners I want to introduce to you is someone that we're working with, and it's an output in part of the priority that's come through the needs assessment process in the past. So Open Path Resource is an important community partner that's helping us right now. It started, I should say, in relationship with our spiritual care team, where they sought to integrate Muslim spiritual care more distinctly into the practices at the hospital. And that led us into relationship with Open Path Resource. And right now, the project that we're working on with them is the opportunity to build a more culturally responsive psychiatric care model. So spiritual care leaders from Open Path Resource are present in our inpatient psychiatric units, introducing and connecting to individuals who identify as Muslim. And in our community and in our facility, many of those individuals are part of our East African community. So this Open Path Resource team works with our care team to try to support individuals to understand their treatment plans, support them to discharge, with really the goal of addressing some community and cultural barriers related to some deep stigma in that community related to mental illness. And so this team is working together in ways to try to keep people on treatment plans, to be able to prevent unnecessary readmissions and ultimately improve quality of life. But the other work with Open Path has been a great multi-year journey. And the other thing I'll just point out on the next slide is another example of the opportunity when you partner with a community agent, like a trusted agent like Open Path, you find other ways to make a difference for patients. And so they also had a chance to work with leaders in our emergency department to be able to place qiblas in the patient exam rooms to help patients know the direction for prayers. And I think, again, it builds on that trusted relationship with a partner and the chance for us to be able to expand our work at Hennepin Healthcare related to culturally responsive care and services. And so now I'm going to hand off to Aida Strom, who's going to help you introduce you to another important community partnership.
Hi, you'll see Indian Health Board prominently listed. And the work that we're doing with Indian Health Board right now in the American Indian community is really based on some work that we did in 2016 with the Community Health Needs Assessment, where maternal child health and better outcomes for families, babies, moms was identified. So we are currently working with Indian Health Board, partnering with Indian Health Board on a maternal child health, culturally responsible group setting for American Indian women in the community and the women who we serve. The curriculum that was developed by community members, experts in our community, and we partnered really closely with not only Indian Health Board, but the Division of Indian Work and Minnesota Indian Women's Resource Center in order to develop curriculum that makes the most sense for the populations we serve and the tribes that are represented at our hospital. And so we had to wait. We had to push it back a few years because of COVID. So we really excitedly started this summer, and it's been very successful. Women are enjoying their experience. They're getting seen and heard in ways that they're reporting they haven't before, as far as maternal child health education is concerned. And we're really excited about expanding this project. Indian Health Board is committed and dedicated and passionate, obviously, about this work, and looking forward to expanding this beyond what we have scheduled right now. And we hope to look at this work as maybe best practice. And so it's really exciting. We're happy to have this and to partner with such a great partner like Indian Health Board.
Good afternoon. My name is Kelly White. I am the Chief Nursing Officer of Hennepin Healthcare. I get the privilege today around talking about this incredible facility. So I hope you had a chance to look around today. It's incredible. We had the privilege of having our board meeting here. And this facility is a really a well-rounded place for housing and healthcare. And it's truly integrated model that promotes housing stability, healthcare, and well-being. In addition to the 173 units of housing in Endeavor's residents that provides a safe place to call home to single adults, Hennepin Healthcare is most appreciative of our partnership with Hennepin County Public Health's Healthcare for the Homeless Catholic Charities and the Richard M. Schultz Family Foundation in creating the Recuperative Care Center. When a person is hospitalized in this part, it is part of a whole entire healing journey. It's the most medically intense part of the journey, often involving surgery or other interventions that bring the need for a period of recovery. The healthcare system needs partnerships like this to support the recovery of our patients, some of the most underserved and underprivileged in our community. They need to be in the right place at the right time. And moving them through this process then makes beds available for the next person who really needs health and hope and healing within our healthcare system. Our system works best when patients can move through that in a journey that's safe, supported during the transition they have, and their unique needs are met. That's where the recuperative or respite care services offered in this new facility play such an important role. The Richard M. Schultz Family Foundation Recuperative Care Center, that is a mouthful, I will tell you, I practiced that 5 times. It has care for up to 30 adults experiencing homelessness who need additional time to recover after being released from the hospital. So what an incredible service. The Hennepin County Healthcare for the Homeless team provides care and coordinates with hospitals and clinics to ensure safe transition from hospital discharge, as well as coordinates needs post-discharge. It truly is a lifeline for patients and for our healthcare system. What is so unique about this program and what we are grateful for is that we actually have healthcare for the homeless RN consults on site in our hospital to help coordinate this seamlessly for our patients who need it most. This is also the home to a new Hennepin County Healthcare for the Homeless clinic, serving both residents here and serving as a public health neighborhood storefront clinic for area residents who require medical support and coordination. In addition to medical care, there is space for psychiatric care for those seeking mental health support on site. It's truly a privilege to have presented this. Thank you. I'm going to pass it off to Wendy.
Thank you. Hello, I'm Wendy Stulak-Matzel. I'm the Chief Ambulatory and Population Health Officer. And I have the opportunity to share with you a program that in a new clinic that we have opened in East Lake Clinic. So our East Lake Clinic opened about a year ago, and it had been closed prior to that due to some of the civil unrest. And we have been in our new space, a co-located space between Hennepin Healthcare East Lake Clinic and Hennepin County Human Services. And we have an opportunity to create and transform a unique healthcare system for our patients. This partnership has given us a beautiful new home. It's very open. The artwork is very beautiful. It's very light, and it's a healing environment for our patients. What's unique in this co-location is the opportunity for us to provide a great asset to our patients through a Bush Foundation grant, and also our Hennepin Healthcare Foundation as well, which supports our trauma-informed healing program. This co-located services, what's really unique about it is it offers our patients an opportunity to really look at their care holistically and bring together our human services program, which includes not only mental health, access to housing services, food and nutrition and employment, but also clinical care in the same space. Our partnership with our community has helped us design this program. It's a new model of care, as I mentioned, and it helped us build out with input from our patients, from our community, and for experts and literature around trauma-informed care. Our team members have been actively engaged in curriculum review of trauma-informed care, both in a first and second session. We have trainers and practitioners that are helping us build out the curriculum within our environments. As we engage our ongoing roadmap to trauma-informed care and our healing model, we hope to continue to provide peer support, program support, and we also impart our engagement with our community as we advance what trauma-informed care means for our community. We currently are seeing about 1,200 patients per month in our trauma-informed care, and we look to continue to grow to serve our community. And with that, I'll pass it to Derek Collings, our Chief Financial Officer.
How are you doing? I'm Derek Hollings, Chief Financial Officer of Hennepin Healthcare. Today, I'm going to talk to you about a health insurance option that we have for employers, and I want to highlight our partnership with the city of Minneapolis, who offer their employees access to affordable and efficient care through our product, Clear Value with Medica insurance option. Clear Value is an innovative collaboration between Hennepin Healthcare and Medica, and is pioneering a new way of delivering care. For more than 5 years, Hennepin has offered an accountable care insurance product. We have a Medicare offering, and we have a commercial offering called Clear Value. Our product is focused on delivering medical quality, accessibility to care, and affordability. We created Clear Value with Medica health insurance as an option for local employers and for small employers. And the city of Minneapolis has led the way as being a medium-sized employer. By developing high-quality care with a coordination approach between insurance coverage and patient care delivery, the healthcare process is simplified and the cost of care is lowered to the patient. This open access insurance option does not require a referral to see participating providers. The consumer experience has been very good, and this is evidenced by a high renewal rate. We look forward to expanding our partnerships with employers who want to offer a high quality, low deductible health insurance option to their employees. One that saves money, keeps them healthy, and stays local, especially in this tight labor market. You can learn more about Clear Value at hennepinhealthcare.org.
Thanks, Derek. I'm back. I'm filling in for Dr. Megan Walsh, our Chief Academic Officer, who unfortunately couldn't be here today. And she truly is the mastermind behind our incredible teaching program. So if you're not aware, Hennepin Healthcare teaches over 50% of providers across the state of Minnesota train within our organization. So a huge footprint, huge impact, and an incredible leader. And every day we hear about the looming crisis of healthcare and of workforce. We're fortunate to have a partner in the Minnesota Department of Health, who, supported by the state legislature, has dialed in and is willing to be creative and seek some solutions. And how do we resolve the challenging workforce market that we have? The exciting output of that is a primary care residency grant program. It is a bold effort to respond to the shortages of primary care across the state of Minnesota. With this grant, we've been able to not just expand primary care with exceptional talent, but to also diversify our healthcare workforce so our clinicians better reflect the community we serve. The grant helps us to train more primary care physicians in Minnesota by funding the costs associated with creating new residency programs, the training of eligible residents in those newly formed slots. It expands capacity and it invests in workforce. It invests in Minnesota residents. Minnesota was recognized by the White House Task Force on New Americans as the first state to implement a comprehensive program to integrate immigrant medical graduates into the physician workforce, making a unique contribution to address pressing health issues like health disparities, workforce shortages, and rising healthcare costs, all in one. Trainees are at clinics and hospitals across the state, and Hennepin Healthcare is the single largest recipient of these grant programs since the program started, positively impacting care, investing in training and jobs, and creating careers for our community. So we're very proud and grateful for the partnership with the state of Minnesota. With that, I will pass off to Teresa.
Good afternoon. I'm Teresa Pesch, and I'm president of the Hennepin Healthcare Foundation. And I want to acknowledge a couple of our board members who are present today, Dr. Israni and Dominic Cerisi and Jennifer DeCaballos. And I think we have many more that are virtually tuning in. We're very proud to exist to really bring philanthropic resources and generosity to the mission and strategic direction of the organization. And particularly, we're proud of a partnership that we've helped this last year with the Firefighters for Healing. The Firefighters for Healing was birthed out of a burn trauma by its founder, Jake LaFair, who is a burn survivor in our burn unit, who was inspired by two young brothers who had been severely burned. And he birthed, with his recovery and healing, a vision for a not-for-profit that existed to support burn families heal, who have a very long journey many times in their healing process, as well as connect deeply with our burn program providers so that they could interact, not just within the burn unit, within the lifelong journey of these patients and families, as well as working with first responders and EMS and providing them with housing. So they had a small vision that's grown to a middle-sized vision that now has grown to a very large vision. They've had 7 family residential units that have been full year-round, supporting care for housing for our burn patients and families. And they are now constructing, so they were in the ground in the middle of the pandemic and are close to being open right next door to us on 500 South 7th Street in Minneapolis. It's going to be a 15,000 square foot transitional healing center. It's one of a kind in this country. There's a model in Canada that they're emulating. And our foundation board members and philanthropists stepped up to get them started with their $6 million campaign, funding a $300,000 commitment, fully funding for sponsoring the living room space. And with this, we'll be able to help housing from North Dakota, South Dakota, Wisconsin, all the way out to Montana, Minnesota, any EMS provider and firefighter that needs medical care that comes to the Twin Cities, and all of our burn patient and families as they heal. So it's an extraordinary partnership we're very proud of, and we're happy to share it with you this afternoon. Jennifer?
Thank you all for the great examples, and thank you to those of us, or those of you who are allowing us to transition between many team members. But it just shows how no one person, no one organization can make a difference with the breadth of the demand and the need across our community. So thank you all for showing how we partner to be the community's healthcare system. Such a variety of partnerships, all focused on building a healthy community and doing it together. As I mentioned in opening remarks, this is a small sample of the many opportunities that we could share with you of where we're enacting through partnership. And over the past year, we've worked closely with community partners to also begin to reimagine the future of Hennepin healthcare and how we serve the community. What we've learned over these last couple of real difficult and challenging years is healthcare must change at its core. It must change to address increased volumes, lower staffing, a request for on-demand care, for virtual health, for easy access to healthcare. Let me hit the easy button to get the healthcare I need, and addressing the systemic health inequities that we spoke of earlier. Our traditional healthcare model is not the healthcare system of the future. We must build it together as partners, and that's our call to action with all of you today. We have started to do just that, to build a healthcare ecosystem for the future, listening to our community first, partnering to apply those learnings to redesigning our care second, and finally, we will apply those new care models to a new downtown campus, a footprint that meets the needs of our community, of our team members, and creates that healthcare system of the future. Our first step started with actively listening and engaging across our community, and we've been doing that for the past 14 months, truly engaging and doing pop-ups and listening. What's working? What's not working with healthcare? How do we do it better? What do you need? And we have heard from community members and leaders, caregivers, families and neighbors, local community. We're here in the Elliott Park neighborhood. We've heard from Elliott Park neighbors, our ambassadors, our elected officials, our clinical care providers, healthcare leaders, and so many more. The process in the past year has been about learning, and it's an important first step forward to deepening our understanding for those who have experienced harm in particular, or discrimination or barriers when trying to access traditional healthcare. As you heard earlier, we're on a journey to creating a more equitable, just, and responsive healthcare system, including what services we offer, how we provide them. The Indian Health Board is an example of community demonstrating what it means to them. Truly redesigning healthcare and what facilities need on our downtown campus and beyond. We've incorporated these, and what we're doing in 2023 looking forward is taking all of those inputs and starting to design what the healthcare system for this community should look like. Everything from access strategies to ensure care is easy and accessible, to technology strategies such as a digital front door virtual care, care at home, care where I want it, to revisioning our emergency department. How do we blend behavioral health needs, addiction needs, trauma needs, community care, all into a healing environment going forward? Reimagining healthcare includes creating a system that works within the facilities that fosters that health and healing. A health system that is built with and belongs to our community. We've been here, as these pictures demonstrate, in this neighborhood since 1887, when the original city hospital opened in a rented home, just a couple blocks from where we are right now. Then Hennepin General Hospital grew to fill a whole city block, and it was our home until the mid-1970s. As such, many buildings on our downtown campus are well past the end of life. We will begin to transform our footprint in 2023 and over the next 7 to 10 years, building in phases to get to the campus that we know our community needs. And as you saw in some earlier pictures around the East Lake Clinic and other sites, that healing, open, vibrant environment that people know they're valued when they come inside our walls, fostering a sense of community, of healing, and of health. So reimagining our future, our campus development in 2023 will happen parallel to the care redesign work. It's really important we lead with our mission. We lead with how care needs to look, and then we build the facilities that help enable that. You will begin to see some preliminary building activity on our campus. In 2023, we will work on expanding our parking facility on 6th Street and Portland Avenue. And that build will help us to accommodate eventual campus movement and further building. And I want to do a shout out to the Elliott Park neighborhood and thank them for supporting this project. The hard work of planning a future campus has only just started. We will continue to engage community on the important questions throughout the process. You can see and provide feedback. We're providing regular updates to the work at hennepinhealthcare.org/our future. You can also go to the top of the website and you'll see our future and click there. We'll continue to make information available as we move and as we pivot. I want to thank Pastor Steve, who is here in the Hope Church, who is working alongside us as we do one of our moves of oxygen tanks. And we know it takes the whole community supporting the work as the campus moves forward. As the care design work moves forward, we're going to start applying those plans to what those building needs look like. I will share our current inpatient units are on a block of buildings that are 50 to 70 years old. So as we plan for the next 50 to 100 years, it will take all of us. We will pursue a bold vision for facilities that meet our community's needs today and tomorrow. And most importantly, that they support a socially just healthcare system that improves on outcomes, on value, on access, and on benefits for the diverse and vibrant community that we are so honored to serve. We have a lot of work ahead of us, but it's also an incredibly exciting time to invest in our community, to invest in health, and to do it together. Thank you to our teams who do this work every day. And as demonstrated, thank you to all of you as partners who have joined us in building for the future. We're excited about the direction of Hennepin Healthcare. With that, you have been very patient and listened to us kind of say, here's what we've been up to. Here's how we've applied the assessment. Here's what's coming in the future. And I want to take the remaining time that we have with you today to listen and hear from you, whether it's to give us input into what your thoughts are, what you want us to hear, or whether it's to ask us a question about something you've heard tonight or something you're wondering about. If you are online, please put your comments, as our chair, Kathy Thunheim, mentioned earlier, in the question and answer. If you're in the room, just feel free to raise your hand. We'll take questions. If we don't get to all the questions, we will be posting a recording of the meeting tonight on our website. We also will follow up and answer any questions we don't get to in writing so that we are making sure that we are responsive. If you've provided us when you registered with your email address, we'll send you a link when the recording is ready. And otherwise, you can find it at hennepinhealthcare.org in the About Us section of the website. And with that, I am being handed questions online. All right, I'm going to put the pressure on the room first. Yes. Thank you, Pastor Steve. And I'll repeat the question for those online that might not be able to hear it. And so correct me keep me honest here. What I'm hearing you ask is about the clinic and specialty care center that we opened up. So the newer portion of our outpatient ambulatory, it is a beautiful building. Thank you. And what we've realized with that building. If you go to our campus, we actually have two new building areas. We have the CSC, as we know it, Clinic and Specialty Care Center. That is the new building that has our outpatient services. And on the far side of the building, we also have the mother baby program. And when you walk between those two buildings, they are both bright, light, welcoming. In the CSC, we have a pianist that comes as a volunteer and plays gentle music. It is made with art that's representative of our community. It is accessible and it's easy to get in, it's easy to get out. So what we've seen is you see people that come in and actually share with us, we feel valued, we feel seen, we feel heard, we feel cared for. And we want to create that same environment. We hear the same thing over at the mother baby program, where it is investing in moms and dads, young families, and the mental health and wellness and early development for our young babies. So we know that criticality of space. What we still need to do is it really is about taking down our older buildings, which are primarily the inpatient. We still have some facilities that need to move out of those older buildings into the CSC. So our first enabler project in partnership with Hennepin County is the purple parking expansion. And then we will look at, we've got some other areas that need to move into the CSC building. And then we will start moving into what does our inpatient footprint look like, which is why that care redesign work is so incredibly important. Because if we don't figure out what the future of healthcare looks like, we're going to build the same thing we have today. And we know that that's not possible. So it is creating that innovative space that works better for people. I think of downtown campus. We often see traumas that happen because of who we are and the services we provide. You think of a trauma that's happened in our community. There's nothing worse than seeing community gathering on a cold sidewalk out front of our buildings, trying to heal, trying to grieve, trying to support each other. And what we want to be is that community healthcare system where they know this is your building, come inside, and we've got space for you to gather. We've got space for you to heal. We've got space for you to be together as community. And that's where we'll look to build in the inpatient units. Thank you for that. Other questions from the group? Yes. So I'll repeat the question again. And so let me make sure I caught it in this building that we're in. Yep. No, it's great. So it is a partnership again between Hennepin County, Catholic Charities, and then some of our medical staff the clinics. And it is over 170 beds. It has been instrumental right now. And I will say what we're seeing across healthcare is with workforce challenges, we see less and less placements available. So the ability to move somebody out of the hospital when they're ready is a real compression point right now. And so what this facility did in particular is said for individuals that have high levels of barriers, meaning they might not have a home to discharge to, but we know they're not well enough. What we've been able to do is move people here very quickly with the right supports from caseworkers, from social workers, and from our medical personnel. So it is growing. It has been open, I believe, a couple of months, maybe 4 or 5 months, not that long. We constantly call over to see, are they at capacity? Is there room in the inn? And they're pushing as many people into the system and accepting. Part of it is we've got to get them to their next safe space. We've got to make sure they've recovered. So the program is working really well. It is huge need. We're legislatively working for medical respite to become a part of our Medicaid benefit set at the state level, because that payment source will allow us to continue these kind of programs that are supported through other dollars currently. So always room for learnings. You saw the gentleman in the video who is sharing his story, but it's been a lifesaver for us and for so many, especially when you think of COVID and all the infectious disease and our ability to not want people in shelter that truly need a safe place to recover. Great partnerships. Yes. I would say everything and anything workforce related is absolutely helpful. However, there are specific, what this was, and you saw pictures, those are real pictures of individuals that are practicing here right now that might not have had a path to practicing, even though they've been trained in other countries. So people having a path here is huge to create that workforce capacity, but it is at every level. It is, how do we get rules and regulations out of our way? How do we speed up rules and regulations? Happy to talk with the Congressman's office, yourself and others to share some specifics, but we're seeing the pressure point at all levels. Nurses, clearly, we're working with the St. Thomas School, new nursing school that has come up to create additional nursing capacity, and really working to create, if you haven't seen our talent garden, it's fabulous. It works with our communities to say, let's help you get into a career path, and let's start from even in high school and create that career path. And so it's internships, mentorships, people that start seeing themselves in healthcare that maybe didn't before. How can we as employers help with getting them in, making it easy, helping fund and have them paid to work? And what I really love here is earlier today, our nutrition services were over providing some food for our board members. And one of the things they said is, I said, how's it going from a staffing perspective? And they said, you keep stealing all of our best of our best. And they're frustrated. And there are people that are coming in to work in our nutrition area, and we're grabbing them and saying, do you want to get further into healthcare? And they're becoming healthcare assistants, HCAs for us. Well, then you get a path into nursing. Then you get a path into being a PA or a physician. All of that is essential, but it is that seed money that helps make it possible for people to get their foot in the door, and the mentorships that are available. So lots of opportunities. Mental health is another area where we're really seeing, we're advocating a lot for people to invest in our community resources, not necessarily even in the healthcare system, but to say we need those nursing homes opening beds up. We need mental health providers opening capacity up, because if people don't have the supports to stay out in the community, they get stuck in a hospital. And that prevents us from being able to respond to the next trauma or the next acute need that comes in our front door. So happy to talk further, but that workforce and that trajectory to open doors is huge. Thank you. I've got some questions online. I'll check in on one is, I may have missed it, but are there any plans in place, all the mental health services in one beautiful building, or will they stay dispersed throughout the campus in dingy units? There's no judgment in that question at all. I will not out the submitter. No, absolutely. So what we have looked at is national models. So we will be pulling together a behavioral health strategy. We're seeing behavioral health needs just skyrocketing right now. And the acuity of what we're seeing present at hospitals is alarming. So our ability to bring together that into a seamless, again, think of that ecosystem of care. We don't care who people work for. It's let's make care easy, and let's partner together to make that a reality. So what we are looking at is, can we designate a whole city block floor that is behavioral health, so that you're not going to different levels of care. We're moving you between an ICU psychiatric response to a less acute unit. We're providing additional supports to family and counseling and therapies and trauma-informed care, all in one seamless space. So absolutely. And we welcome community partnership as we develop that strategy to make sure we get it right, because it shouldn't be us in isolation. It should be us doing it with community. I have another question. I'm curious what you're thinking of as part of a digital front door. Excited to hear this is being considered as part of our future. Thank you. The digital front door is a strategy that we are setting up, and it really is about how do we make care easy. We have all gotten so used to, we would not have put annual meeting virtually very easily 4 years ago. We have all gotten better with technology. We've gotten better with our phones. We've got better with interacting over those little boxes. And so that digital health strategy is about saying, again, how do we make access easy? And what does it look like for various communities? I often think about the moms managing young ones and thinking, do I have to take public transportation somewhere to get the help I need? Do I have to load the kids up? Do I need childcare? What do I do? And the more we can get a digital, easy front door that makes care accessible, we can add a virtual health strategy to make it a reality for people and remove any barrier we can, is really where the focus will be in 2023. And then it'll help us develop what do we need in a campus as a result from that. Another question came in, and I'm watching for in the room, so don't be shy. Are there any efforts in the present programs that promote a healthy lifestyle and drug avoidance for children and teenagers? Great question. The children and teens, I think this is a huge part of our community health needs assessment, is we constantly are watching. We partner with Hennepin County on their SHAPE survey. And when their SHAPE survey comes out, it lets us know what are the trends with young people. Are we seeing use going up? Are we seeing supports going down? What are we seeing as the needs? And then for us to develop those strategies in response to that is essential. So we will absolutely build that into our behavioral health strategies. So when I talk behavioral health, I'm meaning mental health and addiction, And I like the call out that it was in particular for our young people, which there aren't as many services and supports available for today. So we've got some work to do on that. I'm going to go over here and then I'll go over here and then I got one online.
So the question is around trauma-informed care, and just to paraphrase, I believe that how are we leveraging the learnings that we're doing and creating partnership? I'm paraphrasing a little bit, but I think that's the gist of the question. So I would say certainly we are looking to do that. Part of our care model in this co-location model with Hennepin Human Services is to build just that. How do we leverage health and healing? How do we leverage the trauma-informed principles to really look at transforming caring for patients both in our clinical environments, but also in their environments within their community. So as we mentioned before, we've been in this work for probably about the last 1 to 2 years, sponsored by the Bush Foundation grant, as well as our Hennepin Healthcare Foundation. And our work is really, I would say, evolving and transforming. And in fact, I was at a meeting last week with the team, and they just continue to evolve in the work that they do, both internally to the team members that care for patients, but also externally in how they care for the community. Great question. Thank you.
I might have heard a second part of that question too, which is, well, whether we are willing to share and partner. Great answer, Wendy. That's not a critique. But we've had that quite a bit of, can we partner with community partners who also need that training, and happy to have you connect with any of us to share who might have that need. We've set up some of that between us and the county, where we've said, if we're already doing training and we've got open seats, who do we offer them to? It doesn't cost us any more, and it helps spread good work. So happy to talk further about that. Yes. So I'll repeat the question, though you were good at projecting. As an anchor organization, what are we doing to address some of the other needs beyond some of the examples we used in the room today related to housing needs, food needs, utilities, safety needs? We have a role in that because it all plays into health. We are not usually the core provider of that service, but part of it is how do we partner and where do we partner? A good example is the East Lake Clinic. We are in the same building, in the same floor, not just co-located, but truly integrating with Hennepin County Social Services, who connects people to a lot of those services and supports. So they might be coming into us for primary care, for immunizations, for other things. And right alongside us, they can get connected to jobs, to employment, to benefits and support services that they need. So usually it is more about those partnerships. It is also about making sure we're in education, that we're making sure people know where to go to, and how do we, again, get back to that easy button for individuals. In the campus development plan and that care redesign work, we're looking for more ways. So if you have ideas, we want to hear them. More ways that we can bring those resources in. If I've already made it all the way to a healthcare appointment, if I can get additional services, again, to a point of these buildings should be for my total well-being and not just a healthcare place, if we can develop some of those partnerships. One of the requirements of a lot of the buildings in Minneapolis is that we have some storefront space too. So could we bring in healthy foods to a community that needs it? Could we bring in childcare to a community that needs it? Can we embed some of our county social workers here on our campus? Are all opportunities for us as we go forward. I'm going to grab one online, which is, what about the crisis home? It's such a vital resource. For those who don't know, we have operated a 16-bed mental health crisis facility, which is really about keeping people out of the hospital when they just need a higher level of support, or helping them step out of the hospital when they're not quite ready to go to their long-term placement, but they need some support in order to get back into the community. We unfortunately did shut that program down a couple months back, and it spoke to the workforce. It became untenable, the rules and regulations of how we needed to staff that building. We are looking for an intentional partnership to get that building up and operating. We are committed to getting those services because we see the need for mental health. And so we're working really hard with some community partners to say, who can we partner with to make sure we bring that facility back up and operating, because we know how much it's needed in the community. So we'll continue to work on that. I see we're at 5:30. I'm going to be respectful of folks' times. Thank you so much for not leaving us standing up here without any questions and without any engagement, because that's the worst. And thank you above all. I hope you heard that we are really committed to, again, being the health system that serves our community, and doing it in partnership with all of you. So thank you for your investment, your time, and your commitment in Hennepin Healthcare.